So the video quality on this is going to be pretty poor because I'm recording it with my webcam so I can read what I wrote. But I wanted to make a little video to whoever is willing to listen, because looking around at images on the news, it appears like we've lost our fucking minds. Everywhere in the middle of a global pandemic now, there are crowded public spaces, people running to salons, and parties abounding. The resounding mantras when people are confronted being, 1, I'm young and healthy, and 2, the mortality rate is really low. Well, a quick note on the young and healthy. The virus's hallmark is its virulent nature. Young and healthy, you will likely survive, but the chances are almost certain you will infect multiple other people, and those other people will infect other people too. And some of those infections will be at-risk groups, and they do have a high likelihood of dying. They're people too, and their lives have value. To the mortality rate. Everybody focuses entirely on this, but the danger of a virus or any infection is not all in the mortality rate. The percent of infected people who die. Because it's also a game of numbers, and a highly virulent pandemic with a low mortality rate can be just as if not more dangerous than a very fatal virus that is difficult to transmit. Now granted, I'm not an epidemiologist, but I can count numbers. And hopefully someone here will too. So I decided to compare COVID-19 to a disease that no one is going to argue is not very dangerous, which is Ebola. Okay, so we measure how virulent a virus is with what's called the R0, or the number of people each infected person will likely in turn infect. According to the SCIR model, the unrestrained R0 of COVID-19 is around 4.5, which we saw in places like Spain and Germany. Ebola, though it's dangerous, is actually pretty difficult to contract, so its R0 is only about 1.75. But Ebola has a mortality rate averaging about 50% versus COVID being around 0.4% now, if you average in very healthy people and the high-risk people. That's a really low number, and it's easy to assume that that means COVID is not a big deal. So I found an epidemic calculator, and I'm going to provide sources to links to all of this. But in a population of 7 million people with one initial infection, if we adjust the calculator for variables like R0, mortality, infectious period, and recovery period, at 30 days, Ebola will have infected only 3 people and had 1 death. COVID-19's already infected 10. Now, we don't have any deaths yet. By 60 days out, Ebola has affected 12 people. And it's caused 6 deaths. COVID has 19 infections. COVID-19 has 135 infectious people. Now, we've still only had 1 death. But we're talking about an exponential rate of increase. So at 90 days out, Ebola has 48 infectious people, and there's been 25 deaths. COVID has 1,893 infectious people. There's only been 11 deaths, but now the number of people, even at a low mortality rate, who are going to die is going to increase sharply. So let's look out if we don't restrain this thing for half a year, which is around 180 days. Due to recoveries and deaths of currently infected people, Ebola is down to only having 12 infectious people. And it's killed around 160 people. On the other hand, a COVID-19 infection is still burning through the population, and at this point in time you have 21,225 infectious people, and we've had 731 deaths. So by the end of everything, Ebola has only infected around a total of 660 people out of a 7 million person population. And even with the high mortality rate, it can't catch up to COVID. In a large number, lower mortality rates can still result in a virus that will kill orders of magnitude more people. So if you look at that, you also have the strain on healthcare because you have tens to hundreds of thousands of sick people to care for as opposed to a few hundred. So on top of the COVID deaths, you are getting deaths from things like untreated heart attacks or just lack of access to medical care that could have saved their life. So please, for the love of basic sense and humanity towards at-risk people, distance, wear a mask. Believe it or not, it's as much for others, because you spread the virus and feel fine, as it is for you. Follow basic steps to mitigate this virus. In places where they've actually done this, they've dropped the R naught down to less than 1. And this is what we're shooting for in the United States. I know probably by now 99% of people have already completely checked out of this or moved on to something different. But the few who haven't, maybe there will be behavioral changes. Maybe some of you will be better informed to explain why this is important. But I just wanted to address why people are focusing on just the mortality rate, or, the fact that they're young and healthy, but they don't consider the fact that 1% of a million is way higher than 90% of 10. So, that's just as important. And that matters just as much in determining, how bad this is going to get for your community. So I guess that's it. I just had to get that off my chest. All right. Peace.